Question number 5. Be sure to review with the physical therapist how to get the patient safely into the home. That, I think, is huge.
Yes.
You get your loved one from the facility and you bring them home.
Right.
You get them out of the car, but maybe you got a couple of steps to get into it.
Right. So you want to review, and usually they typically do that, but you want to kind of know and let them know what entry you have or what entries you have into your home, and they'll help you figure out which way would probably be the best. And they're going to give you the techniques to get that person into the house, whether it's sometimes if there's just like 1 or 2 steps, we may actually have the person go up backwards and push themselves up with the walker. I know that sounds strange, but once you're trained on it, it's actually much easier than trying to take them up forward.
Easier for everybody.
Everybody, especially if they have some kind of a weight-bearing restriction on a leg or something like that. But yeah, the therapist can certainly help you figure out what's the best way to get them into the home.
Question number 6. If the patient is dealing with pain, ask if pain medication can be administered just before leaving the hospital. I think that one is it is huge, and I think it's probably one of the best pieces of advice that we usually give people.
Right. Because time and time again, especially, after a surgery or something like that, if you miss that window, sometimes the discharge process may take a little bit longer than expected. By the time you get them discharged, get them in the car, get them home, and then most of the time you come home with a prescription that you then have to go to the drugstore to get filled. That sometimes can get delayed, and there are times that the loved one can get behind in their pain.
Right.
And so if they have been on a pain medication regimen, talk to nursing, work with them, and see if something can't be given or timed to be given right before they leave, so that you don't have that gap, because that can make the first night absolutely miserable for everybody.
Yeah. That's such a great piece of advice.